Japan says highly infectious strains of COVID-19 are becoming dominant as cases continue to surge. The hardest hit prefecture, Osaka, is waiting for permission to impose some of its strictest measures since the pandemic started. Tokyo and Kyoto are expected to follow. Michio Ishida reports.
With Osaka's request, Japan may be bracing for a lockdown in its truest sense for the first time since the COVID-19 pandemic began. Japan's second largest city is exploring the options of shutting down bars and restaurants completely or allowing them to operate until 8 p.m. on weekdays but with an alcohol ban. It also wants department stores and underground malls shut and events cancelled or postponed. The details are being worked out with the central government. This as neighboring Hyogo, which has seen new cases surge in recent days, decided to follow suit and ask for the highest level of response. Meanwhile, Kyoto, also from the nearby region, as well as Tokyo, are weighing their options. While Tokyo is considering the possibility of a fresh state of emergency, the public is not convinced that without a mandatory shutdown order, it will be enough to bring the latest wave under control. If adopted in all four regions, the emergency measures would cover close to a quarter of Japan's population of 126 million. New declarations would mark the third full state of emergency in Japan since the pandemic began. Prime Minister Yoshihide Suga says that there will be no impact on the hosting of the Tokyo Olympic Games in July. But the organizers will have to decide on the number of spectators that they'll allow to stadiums. And the decision was supposed to come this April, but that's been postponed, and it's likely to be postponed until June. On Wednesday, Chief Cabinet Secretary Katsunobu Kato repeated the government's stance that it would consider any request for a state of emergency declaration swiftly without elaborating on a time frame. Quasi-emergency measures were already imposed in 10 of Japan's 47 prefectures, including the Tokyo and Osaka areas. Michio Ishida, CNA, Tokyo.